What does informed consent for Paxil, otherwise known as paroxetine, look like? My name is Dr. Ruth Dutton. I'm a board-certified adult psychiatrist, and I talk a lot on this app about the importance of providing full informed consent when starting a psychiatric medication, as well as concepts of safety prescribing when clinically appropriate. And I've been going through a series where each day I talk about one of our most commonly prescribed psychiatric medications, and I go through the informed consent process as I would with one of my patients. So today we're talking about Paxil, or paroxetine, which is one of the SSRIs. So like the other SSRIs, it acts by selectively inhibiting the SERT receptor, which prevents reuptake of serotonin and functionally increases the available amount of serotonin. Of course, this is a gross oversimplification of what it does, but that is what it is advertised as doing. Paroxetine is FDA approved for a number of conditions, including things like major depressive disorder, generalized anxiety disorder, post-traumatic stress disorder, obsessive compulsive disorder, panic disorder, social anxiety disorder, as well as PMDD. Additionally, it has an FDA approval for the use of hot flashes or other vasomotor symptoms in perimenopause. And of course, it's going to be used off-label for several psychiatric, but also several somatic as well, things like irritable bowel syndrome, as well as premature ejaculation. So I generally do not start paroxetine as a first-line SSRI, and that's because it's going to have more anticholinergic and antihistaminergic activity, meaning that it is going to have a greater side effect burden. Additionally, it has a really short half-life, which means that if you miss a dose, that you're probably going to feel withdrawal for missing that dose. And additionally, it's much harder to taper off of this medication in general. However, there can be some somatic benefits, like for women who are in perimenopause or people with gut issues. Also, because it's more sedating and calming, it can be better for people who have sleep issues or anxiety. So side effects are going to be similar to those that I warn all patients about with SSRIs, things like headache, upset stomach, dizziness, fatigue, nausea, diarrhea, constipation. I'm going to recommend taking this with food to minimize the risk of these side effects. For most people, Paxil is going to be sedating, so I do recommend taking it at night. Sexual side effects are pretty likely with this medication, and although in most cases this is going to resolve upon discontinuation of the medication, sometimes they can persist beyond that, leading to post-SSRI sexual dysfunction. Potential adverse effects: there's going to be an increased risk of bleeding with the SSRIs, as well as the black box warning for suicidal ideation, particularly for adolescent populations through age 25. If you have a history of mania or are vulnerable to bipolar disorder, then there is that risk of destabilizing the mood and triggering mania. There's also a risk of hyponatremia or low sodium levels. Sometimes people can get tremors or akathisia, where they have an intense sense of internal restlessness. There can be blurry eyes, dry mouth, urinary issues. We also have to use these medications with caution in those with an anatomical narrow angle of their eye, because you can have something called acute angle closure glaucoma, which is a very serious medical condition and can lead to blindness. As I stated previously, Paxil is going to be pretty challenging to get off of, and so it's going to be important that in most cases, you're using a hyperbolic taper approach, meaning going down by a set percentage of the dose rather than a set milligram amount. Most of the time when I'm prescribing this medication, it's because it's something that someone has been on for years and they feel like it's the only thing that has worked for them. But of course, there are going to be cases where it is effective and appropriate for that individual. If there's any other psychiatric medications that you want to hear me go through the informed consent process for, then please put it in the comments below. I'm also putting together an email list so that I can distribute resources and potential learning opportunities directly to you all. So if that's you, then send me a DM with your email, and I'll see you in the next one.